Millions of Americans are now on the brink of seeing their health insurance costs skyrocket when extended subsidies for Obamacare users expire at the end of the day tomorrow. Recently, CNN met one couple in New Jersey whose monthly premium will spike from $340, kind of manageable there, to almost $2,000 starting January 1st. They can't afford it, and they say it means they'll have to be uninsured. They're far from alone. There are 24 million Obamacare enrollees. Over the last month on Capitol Hill, Democratic and Republican lawmakers tried to address the problem, but days before Christmas, the Republican-led House and Senate adjourned, and Congress left town without a deal. According to the latest polling from the nonprofit Kaiser Family Foundation, most enrollees blame the president and Republicans for what happens after tomorrow. 34% faulting Trump, 29% Republicans, while 19% will blame Democrats. Veteran pollster and communications strategist Frank Luntz is with us now. Frank, Speaker Johnson and President Trump, and we hear it from Republicans over and over, blaming Obamacare for this. We should note fact checkers have found Obamacare didn't play that role in hugely increasing insurance premium costs. But of course, we know that doesn't always factor into whether voters believe something or not. Are voters buying this finger pointing on Obamacare?
No, and they don't like it, and they resent it, and this is going to play a major role in the 2026 election. The shutdown that we experienced, the longest ever in American history, started off hurting Democrats more than Republicans, ended up hurting President Trump more than anybody else. If the government does shut down because they still can't find a solution to this, it is going to be very painful for the Republican Party because, as you note, every survey, every poll that's out there shows that Republicans will be hurt more by this than Democrats. But in the end, it's not about polling. It's not about politics or about elections. In the end, we have a significant percentage, millions and millions of people who cannot afford their health care. And this becomes an issue not just of affordability, but expense. I know it sounds the same, but in the polling that we've done, the public thinks that American healthcare is simply too expensive, and they will be grateful for any solution that brings down that cost.
Yet, how on the hook are Republicans for providing that solution? Because when we talk to them, they talk a lot about Republican proposals to address the cost of health care, and yet it's been 15 years since Obamacare passed, and you have these subsidies about to expire and ratcheting up the pressure.
Well, the pressure is significant. And in the end, it doesn't matter whether it's the subsidy. What matters is the overall cost. The public does not know the details of this. And frankly, they don't really care. If they can afford their health care, they're grateful. If they can't, they're angry. They're pissed off. And that is what both sides need to hear, that Democrats are wrong for pushing a government-oriented solution. Republicans are wrong for pushing free market. Both. We don't want government bureaucrats determining our health care. We don't want insurance company bureaucrats. We simply want to have the choice and the control, the affordability, and delivered by the doctors and hospitals that we trust. And it's a very simple process. It's very expensive. They said it was going to be this expensive when Obamacare was passed back, as you say, a dozen years ago, but they have to solve it. And because the Republicans are in charge, they will be expected to have that solution.
George W. Bush's advisor, former advisor Karl Rove, put out his perspective on the political year that was 2025, writing, Americans would be much more likely to support Mr. Trump if he explained what he's doing and asked for patience as his administration makes necessary changes, but that isn't his way. Presidents do best when they underpromise and overdeliver. The opposite, overpromising and underdelivering, angers voters. They often take out their anger at the ballot box. What does President Trump and Republicans have to do if they don't want voters to take that out on them at the ballot box come the midterms?
Well, let's talk about healthcare and stay on that topic. There is a system, it's called HSAs, and they provide a little bit more limited care, but they give people the choice and control that they want and need. And that is a solution because it makes healthcare much more affordable. but they're not doing a good enough job explaining that the party is divided right now. The Democrats are not united either. And the fact is, the only thing that's less popular right now than the Republican Party is the Democratic Party. Polls, including yours, show Democrats at an all-time low in terms of public support, in terms of credibility. Right now, it's a pox on both your houses, and I've cleaned up my language there because the public is tired of both sides yelling at each other, blaming each other while things get worse.
As many of us prepare to ring in the new year, millions of Americans under the Affordable Care Act are bracing for their health insurance costs to surge. On January 1st, extended subsidies for Obamacare will expire after Congress failed to find a solution despite weeks of back and forth talks on Capitol Hill. And for many, the reality now means pay a lot more for health care or go without it. Joining us now is someone facing this dilemma, Jeremy Kulish. Jeremy, thank you so much for taking time to talk about your situation. I think this really illustrates for people what folks are going through. And let's start first with why you qualified for the ACA subsidy to begin with.
Yes, of course. Thank you for having me on. Happy to share my story. I'm a software developer. And had for the past 6 years, was in a senior position at the Census Bureau on a long-term contract until May. And that contract was canceled by the Trump administration as part of the downsizing efforts. And that thrust me into a very difficult job market that I am still navigating and still seeking my next opportunity. There have been a lot of stressful things about that, but the healthcare plan that I got through the marketplace and the subsidies that allow me to afford it have really been a blessing. They were easy to navigate. Somebody helped me find the plan I like, and it is a great plan. I'd love to be able to stay on it if the opportunity were there, but
that's
sadly,
a lot.
It's no longer going to be affordable.
Yeah, so talk about that. When you're talking about it's not affordable, what were you paying per month and what would it go to without the subsidy?
So I've been paying $392 a month for my current plan, which is quite a good plan. And it's enabled me to really ensure continuity of care for a couple chronic conditions I have and my wife has as well. The plan, when I saw on the marketplace without subsidies, it would be something like $1,608, give or take. That is not a number I can afford. And I can't imagine who could afford that, who is in the position to be needing subsidies.
So tell me, so what are you doing? What are you going to do then?
So, because my situation is still very fluid, I have no demonstrable income that I can show when working, through determining what benefits are available to me, and that enabled my wife and I to go on to Medicaid. That comes with its own issues. I'm very grateful for it, and Medicaid is extremely important, of course. But it's a disruption of my care, and I am actually going to be getting a procedure tomorrow that I had planned for January. I was lucky to be able to that there was a cancellation. It's pretty important. It's a long-awaited maintenance procedure.
Yeah, to get it in on the last day of the year under the old program, and that's incredibly stressful if you have chronic conditions. And I mean, you have care, which is something, right? But I hear what you're saying. You're saying you're worried that it's not going to be what it was this past year for the care for these chronic conditions. You're looking at this next year. The House will come back. They're going to vote in January on extending subsidies for 3 years. But then the measure faces a difficult path in the Senate. What's your message to lawmakers who are looking at this issue and considering this bill?
Yeah, I mean, one, it's a little late. The choices have been made already during the open enrollment window, and millions of families have already realize they're going to have to go without coverage or pay a pretty insane share of their income to do it. The main thing, though, I believe, is that healthcare is a fundamental right in an advanced society like this. I truly believe that. And there are real people's lives at stake here. We aren't numbers on a spreadsheet. We aren't political footballs. We are human beings. And like we deserve to be treated with respect and have the dignity of being able to care for our health.
Yeah. Jeremy, you've been through a lot this past year. I certainly hope that 2026 brings some bright spots for you as you are looking for work, and that you have continued good health management, I will say. Jeremy Kulish, thank you so much for being with us.
Thank you.